If you have topics you would like to have us discuss on the Aging Well podcast, please click on the links in the episode description to send us a text or record your message or comments. We'd love to hear from you and how we can help you age well. If you benefit from the Aging Well podcast and would like to support the content financially, please click on the Support the Show link or support our affiliates and advertisers. Welcome to the Aging Well podcast. I'm Jeff Armstrong here with Corbin Bruton. In this and the episodes that follow, we will share candid discussions on aging and hear from the experts. We are here to inform and encourage as we experience, aging. In this episode, I'm joined by Dr. John Neustadt, a doctor of naturopathic medicine and founder and president of Nutritional Biochemistry Incorporated. Dr. Neustadt has published more than 100 medical articles, written 4 health and wellness books, and is now a #1 Amazon bestseller author in the field of osteoporosis. His most recent book is Fracture Proof Your Bones, a comprehensive guide to osteoporosis. Dr. Neustadt was also an editor of the textbook Laboratory Evaluations for Integrative and Functional Medicine, which is used across the United States to train and educate physicians on using functional medicine with their patients. So, Dr. Neustadt, welcome to the Aging Well podcast. We'll begin by just having you tell the listeners a little bit about yourself.
I am currently in San Diego, and I grew up down here, although I've traveled all over, lived different places in the world and in the country. Was in Montana for 6 years, Seattle for 13 years, overseas for a couple of years in different places. And through all of that, I really formed an impression of how people are living in various areas, how their societies are organized and how they're organizing their time, and how that impacts their health. And I took that into medical school with me. When I ended up going, it was not my first career. Fell in love with biochemistry, fell in love with botanical medicine, and started researching ways to help people naturally improve their health. And pharmaceuticals are fantastic when necessary, but there's so much we can do without them. And I had patients coming into me for osteoporosis. I was treating them as I was taught. Their bone density was going up. My mother-in-law has osteoporosis, and her bone density was going up. She was working with her physician. She ended up fracturing. She tripped on an area rug and broke her hip, although she was taking Fosamax. So by all objective measures, she was doing great. And I started to think something's wrong with this picture. So I dove into the research, and I started to understand that a bone density test and the primary measure that indicates bone health that's used conventionally is woefully inadequate for actually predicting what we're most concerned about, which is breaking a bone. A woman with osteoporosis, a bone density test only predicts 44% of them who will fracture. And for men, it's even worse. It's only 21%. So I started looking at underlying causes of osteoporosis, underlying causes of fractures, and what we can do holistically from an integrated perspective to stack the deck in somebody's favor. But not only reduce their fracture risk, but what can we do to regrow bone? Because it is possible to do that. I started a company because I couldn't find the supplements. I was working with people nutritionally that had the dose or combination of nutrients shown in clinical trials to work. They didn't exist in existing products. And unfortunately, a lot of buyer beware out there where companies will state and put on their website a study, but then they'll use a lower dose of the nutrient than was shown in the study to even work. So I started creating solutions for my patients and writing and trying to educate people on what they can do. And it's just grown from there. The start was 17, 18 years ago now.
Great. So, Dr. Neustadt, can you explain for our listeners the difference between naturopathic medicine and traditional medicine?
Naturopathic medicine at its core is integrative medicine. It's holistic medicine. if you look at the training of a naturopathic doctor versus a conventional medical doctor, what you'll notice right away is that there are classes in naturopathic medical school in pharmacology, like there is in conventional medical school, in the ologies, other ologies, like gastroenterology, and there's obstetrician, gynecology, those sorts of classes. But then we also have classes in nutritional medicine and classes in botanical medicine, classes in lifestyle counseling. It's a more holistic approach, and that stems from the philosophy of naturopathic medicine. Both medical doctors, conventionally trained physicians, and naturopathic doctors have the core principle of first do no harm. But what does that really mean? What underlies that? And in naturopathic medicine, it's defined even further. If you ask a medical doctor, what does that mean? There's nothing in their training that guides their decision making when it comes to that first principle. With naturopathic medicine, there is. So that's one of our guiding principles. But other principles that we're taught in the philosophy of naturopathic medicine is doctor as teacher. I mean, part of our role is to teach patients what they can do to take charge of their health, to take better care of themselves, treat the underlying cause. That's another tenet of naturopathic medicine, not just treating a symptom with a pharmaceutical. Most pharmaceuticals just mask a symptom. And we're trying to understand what is actually causing it and can we correct the underlying cause. Part of that then leads to the next tenet, which is treat the whole person, where we're not just treating an individual symptom, we're looking holistically at the entire person. And there are a few more, and then one of them also is prevention. And that is, the best medicine obviously is prevention. But if we can treat somebody in a way that restores their health, one of the other philosophies is the healing power of nature. Can we work with the body's own biochemistry and natural healing mechanisms that exist in all of us to restore health? And if we do that, the best therapeutics, the best approaches are not only going to help what's bothering somebody now, but it's going to help prevent future disease and problems as well. That's the big, kind of philosophical paradigm differences between conventional doctors and naturopathic doctors. And because of that, naturopathic doctors, you're not going to see one in just a quick 10-minute, 15-minute first appointment. Typically the first appointment is going to be longer, 45 minutes, an hour, because we just can't learn enough about somebody and ask enough questions to understand enough to really do the best job we can. Contrasting that with a medical doctor, which was my experience, I started to get sick in my 20s. I was working in high tech in the Seattle area. I was a project manager at a software company. And I went to a medical doctor because that's what my insurance would cover. And I just looked in the book or looked at the list, who was there. Didn't have a doctor before, went there. He walked into the room with his prescription pad in his hand. And I was trying to ask him questions to understand what was going on with me. And it was evident that he just wanted to write me a prescription and move on to the next patient. And even said to me, you just have to live with it. Well, medicine is a service industry. And I didn't like the service I got. I had heard about Bastyr University, a naturopathic medical school in the Seattle area. They had a teaching clinic down the street. So I decided, let me give these folks a shot. Let me see what they have to say. The appointment was 45 minutes long. The chief medical officer was the attending doctor, and he had two clinician students. They got to know me so well. The physician got to know me so well that at the very end of that appointment, besides answering all of my questions and being patient with me and telling me things I could do beyond just drugs, that he said to me, looked at me, he said, you need to quit your job. He had identified that truly was the underlying cause of what was going on with me. I was in a profession, in a field that I couldn't stand. And that chronic stress was starting to take its toll and devastate my health. Now, I had already been thinking about switching careers. I was looking at medical school options. And at that point in my life, that was the third party validation I needed. Somebody, holding a mirror up to me And the next week, I left my job and started enrolling into medical school at Bastyr University for naturopathic medicine.
On the podcast, we tend to really favor talking about the preventative side of aging as opposed to the reactive side of aging. And it sounds like naturopathic medicine is very much in that realm. And as a professor of exercise science, I'm often quite frustrated and share my frustrations with my students regarding the use of the phrase functional exercise. And I feel all exercise should be functional. And so it's kind of a redundant term. And I often feel the same about medicine. And you've kind of alluded to this a little bit already, but I feel like there's a functional medicine and there's dysfunctional medicine. What's missing in traditional approaches to the treatment of diseases and pathologies?
Yeah, that's a great question. And there are different ways to answer it. And I would start off by saying one of the most glaring things for me that's missing in the conventional medical system is that physicians are not trained to have conversations about diet and lifestyle. Researchers have shown that when it comes from that doctor-patient relationship and the doctor is talking to the patient, it carries more weight than if they were to simply refer them to a dietitian, refer them to a nutritionist. And that's one of the challenges and one of the problems is that those conversations are constricted to largely a recommendation of you should, exercise and eat healthy, without being able to go into the details of what that really means, or for the doctor to understand enough to be able to ask questions and create a customized approach for each person. Because it means what might be the right diet for you or might be the right exercise regimen for you may not be the same for me, or we may need to customize things a little bit to make it safe, to make it more effective. They don't have any training in nutritional medicine, maybe one class, but no real training in nutritional medicine. The financial incentives in the healthcare system for conventional doctors who are taking insurance is about a volume of patients, not about outcomes. It's about how many patients can you see in a day, or how many procedures can you see a day, because your compensation is based on volume of patients, not outcomes. And so that means that they're constricted to 10-minute, 12-minute appointments, and it's impossible to have those deeper, more nuanced conversations in such a short amount of time. The other thing is conventional doctors aren't trained to think holistically. They're trained, into different body systems. You've got some, here's your liver, and here's your intestines, and here's your brain, and here's your skin. And they're not taught to understand and think, what is the connection between all of those? Because ultimately it is all connected. In fact, we know, and the research supports, that if you have a rash that moves around from place to place, that's called a migratory rash, that actually can be coming from your gut, from dysbiosis in your intestines. If you have, and that's just one example of how these things that seem to be separate are really quite connected. Similar with osteoporosis. If you have low bone density or have osteoporosis, there are many different causes of that. One can be something coming from your gut, chronic inflammation in the intestines. And so there are just many things that the conventional educational system with physicians is missing. Another one is testing, the functional testing, looking at, what are the best lab values for, even if you just look at iron deficiency. The screen for iron deficiency is a CBC, which is red blood cells, hemoglobin, hematocrit, red cell distribution width. It gives those numbers, and that will tell the doctor, well, do you have iron deficiency, or do you have anemia? But they're not ordering the ferritin test, a serum ferritin test, routinely. In laboratory textbooks even say that is the most sensitive indicator for iron status. It is the storage, it's the reservoir for iron. You can have low ferritin, or even ferritin in the normal range, but towards the lower end, and have symptoms of fatigue and depression before it even shows up as iron deficiency anemia on a CBC, because red blood cells live for about 90 days. So that reservoir, that storage of iron that's used for so many other things besides just in your red blood cells, is being depleted, and it's affecting your physiology. It's affecting your biochemistry and your cellular functioning months before it shows up in a CBC. And so even that looking at testing and interpreting testing is not adequate for understanding the nutritional impacts or components of health.
Well, I teach my students that there are essentially 5 things they need to do to remain healthy and age well. These are exercise, get plenty of physical activity, eat a healthy diet, maintain a healthy body composition, get good sleep hygiene, and don't smoke. Am I missing anything?
I love everything that you said. There's one thing that I think you're missing, and that is community connection. Connection with people in your community, having purpose, having, being going out and doing things with friends, volunteering, research over and over again have shown the health benefits of that, both in terms of longevity, but also in terms of reducing the risk for chronic diseases. So that's one thing that I would just add.
Well, I need to bump it up to 6 instead of 5, because we do talk a lot about the role of connectivity and everything in aging well. So I think I'm going to add that in. So I'll credit you to that. And I was thinking earlier, as you're talking about the medical training and everything, I'm really of a mindset. I know it's a bit of a biased mindset, but I feel like every pre-medicine program should be an exercise science program where they're learning the physiology of exercise, they're learning about diet, they're learning about movement and all those types of things. Obviously, that doesn't mean that's the only way to be a successful doctor, but I have my biases because I think a lot of biology majors don't get all of that training, and they basically, biology, chemistry, they go in thinking, okay, I know a basic understanding of physiology and I know enough to say, okay, this drug works, that drug doesn't work, I'm going to prescribe a drug, rather than, like you've talked about, going to the underlying cause of the disease. And sometimes that cause is something far more than a physiological factor. We teach in our program now, I've kind of adopted a bit of I don't know what you'd call it, but all my slides, whenever I present any slides, have biomechanical psychosocial on them to remind the students that our treatment, our interaction with disease and health is always, there's a biological component, a mechanical component, a psychological component, and a sociological component to our health. And I think that kind of underscores a piece about connectivity.
I love that. And you bring up something for me that really clarifies what we were just talking about a couple of minutes ago in terms of the educational part of the medical education challenges that we're having in this country. Every organization, every medical organization, the CDC, the NIH agrees that the foundation of long-term health is not genetics, although that can impact things. As we get older, chronic diseases are determined more by our diet, our lifestyle, and our sleep habits, and exercise or lack thereof. And if that is truly the foundation of health, that there's no disagreement that is, why is that not being taught as the foundation in medical school?
I think we know the answer. It's the dollar. There's not as much money in telling somebody how to live healthy than there is in trying to cure that dishealth. I want to kind of switch a little bit toward your book. You specialized in hard to treat chronic degenerative diseases. I feel that that's very much in line with my interest in pathophysiology and exercise, which is one of the courses I teach. And I know I could probably pick your brain for days here about different conditions and how we can treat those more naturally and holistically as opposed to traditionally. But let's start with your recent book, Fracture Proof Your Bones, A Comprehensive Guide to Osteoporosis. The title implies that osteoporosis is preventable. Tell us first about the book and why you wrote it.
I wrote the book because it's an area that I've specialized in. I lecture at medical conferences all the time. I think I did 8 medical conference talks just last year alone on this, educating physicians. It is an emphasis in my newsletters and articles I write on my website and for my subscribers. I've got products for bone health. And I talked a little bit early on in this interview about my history professionally and what I was seeing in clinic and why I decided to specialize in bone health and osteoporosis. And over the years, I keep getting all these questions. One of the beautiful things about how my career has evolved is when I was in my clinic, I could only help people who physically came through my door. And I wanted to help more people. My goal and my passion is to help as many people as possible, especially with this deadly disease that is osteoporosis. Because if you have osteoporosis and you fracture a hip, there's up to a 36% chance that you're going to be dead within a year. And half of those people never regain their pre-fracture level of mobility and pain-free lifestyle that they had before. And so this book is the culmination of 15, 17 years of research and work, and walks people through how they can create a holistic bone health plan for themselves and gives them questions to ask their doctors to make sure that they're getting the best possible advice. Because unfortunately, there is no osteoporosis specialty in the medical system. It is up to typically the primary care provider to screen for this disease. And yet 95% of eligible patients are not getting screened for osteoporosis. And then there's a lot of confusion out there among doctors about, well, how do I even interpret the test results? And if I'm going to prescribe a medication, what's the best one to prescribe? And they are not taught what the evidence shows in the research are the most effective ways at reducing fracture risk. And fractures are the most dangerous thing with osteoporosis, not a number on a test, not that bone density test number. It's whether or not you break a bone. And like we were talking about before, diet, lifestyle, exercise, all of these things have been shown to reduce fractures in people with osteoporosis and to reduce the risk of osteoporosis. And those aren't things that their doctors are not talking to them about. So this book was an attempt for me to provide a resource to the public so that they can go step by step, chapter by chapter, and identify risks in their life that are maybe damaging bone and causing osteoporosis, so they can hopefully remove those risks. And then also what they can do proactively, positively, to maintain their bone strength, to improve their bone density, and to reduce their fractures.
Great. And that book is available on Amazon, right? So we will provide a link to the listeners. And you've explained a little bit about kind of what osteoporosis is, but who's at risk and how do we prevent it to age well?
So the current understanding is that the biggest risk is in postmenopausal women. During menopause and for the 10 years after are the fastest rate of bone loss, because that is when estrogen goes down. And estrogen in women, but also in men, is anabolic. It helps maintain and build strong bones. And so as women get older and go through menopause, that then is the biggest, the highest risk years for developing osteoporosis. But there are younger men and women who are at risk and who are not being adequately counseled about the risks or screened for them. And I'll give you a few examples. One of any woman who has had a eating disorder, that is a risk factor for osteoporosis. If you are an athlete, the female athlete triad that I know that you're familiar with, that is a risk factor for osteoporosis. And if you are on medications, and there's a long list of medications that damage bone and increase fracture risk, that's a risk factor for osteoporosis in men and in women. Some of the common ones that people aren't aware of, but are just being doled out like candy, are the antidepressants. Anything that artificially increases serotonin, like the selective serotonin reuptake inhibitors, Prozac, Lexapro, those damage bone because there are serotonin receptors on bone cells. And when you get an abnormally high concentration of serotonin, in fact, most serotonin in the body is not in the brain. People probably understand or have heard of serotonin as one of our happy chemicals in our brain. But about 90% of the serotonin is not in the brain at all. It's produced by cells in our intestines. And there are serotonin receptors in bone. And when that serotonin increases, it activates a type of bone cell called osteoclasts that destroys bone. So we have two primary cells in bone, the osteoblasts. They build up new healthy bone. Osteoclasts break down old worn out bone in a process called bone remodeling. And we need that. That's a healthy process. We need it for healthy bone. Every 10 years, in fact, about every 10 years, that process has completely created all new bone. Your bone is completely turned over. But what happens in osteoporosis is essentially and fundamentally a disease of imbalance. The system is out of balance, and many medications disrupt that balance and increase those bone breakdown cells, those osteoclasts, and decrease the bone building cells, those osteoblasts. And so you end up losing bone. And for people who are taking those SSRI medications, multiple studies have been done looking at this. And we know now that for everyone taking it for 1 to 5 years, we would expect if you have 19 patients taking that medication, that one of them will break a bone. Similarly, with acid blocking medications, the proton pump inhibitors, those first FDA warning about the impact on bone health and osteoporosis was in 2010. So this is not new information. And now we know that people taking those medications, which were never approved by the FDA for long-term use, for 4 years is associated with a 60% increased risk of hip fracture. So, and that's a short list. There are many other medications that do that. So lack of sleep is a risk factor. Not getting enough sleep is associated with bone loss and osteoporosis. And so the list just goes on and on. Everybody, I hope, should be aware of this because it's not just a condition and a disease of the elderly. More and more, I'm seeing it in younger women, and I'm seeing more in men, although it's considered that 80% of osteoporosis cases are in women and only 20% in men. More and more, I'm getting men reaching out to me with osteoporosis. And so it should be on everybody's radar.
Yeah, I've kind of come to that conclusion that men need to be a little bit more aware in this generation about osteoporosis than maybe previous generations, just because of lifestyle changes and things like that. And so I really try and emphasize that with my students. And in exercise physiology, kind of the fundamental approach that you'll see in the textbooks is that in order to reduce the risk of osteoporosis, it's weight-bearing exercise prior to the first menses and estrogen therapy perimenopausal. And yet we don't really talk about all the stuff that you've just talked about in the middle. And I was just thinking, wow, we're promoting exercise in females, but we're not getting them to also consider the role of diet and the other health issues that lead to like the female athlete triad and those types of things. And so you kind of give me a lot of pause for thought there. So what is medicine-induced osteoporosis?
I think the name is one of these labels that does a good job of indicating exactly what it is. It's medications that cause osteoporosis. They damage bone. They increase the risk of fractures, and it's a real blind spot in the conventional medical community. They don't understand how many drugs there are and what drugs that are damaging bone and increasing fracture risk and osteoporosis risk. And I'll give you an example. There's a study that came out a couple years ago that looked at the medications that patients were taking 4 months before they broke a bone and ended up in the hospital. So these patients were hospitalized with fractures. They looked at the medications that they were taking prior to the fracture and then the medications they were taking when they were discharged. And what they found is that the physicians recognized some of the medications that were damaging bone, commonly understood too, like prednisone, dexamethasone, any of those in the category what are called glucocorticoids are potent, powerful bone destroyers, that they reduced or removed those medications, but and there are other medications as well that create those risks. But overall, there was no net benefit because they just put them on other medications that also increase the risk for osteoporosis and fractures. So overall, there was no net benefit. So let me give you some other examples. I already talked about antidepressants. I talked about acid blocking medications. I just mentioned glucocorticoids, which are powerful anti-inflammatories and that are often used for autoimmune diseases. Those are commonly understood. The prednisone type drugs, commonly understood. Less understood are the antidepressants. Doctors don't typically know they're prescribing these medications for people, and it's damaging bone. The other category that's a common medication and was shown to be a major contributor to these fractures in this study I mentioned are the hypertension medications for high blood pressure. So those, most of them don't damage bone directly, but what happens is when the medication dose is too high, it drops blood pressure too low and people get dizzy. And it increases their risk for falls and fall-related injuries like fractures. In fact, 95% of fractures occur because somebody falls. So anything we can do to reduce somebody's risk for falling, we're naturally reducing their risk for fractures. And obviously exercise, anything that improves balance and strength is part of that prescription. Medications, though, can increase the risk for falls, not just the blood pressure medications, but medications that are used to treat anxiety and that are commonly prescribed for insomnia, the benzodiazepine or what are called benzodiazepine-like drugs, or they're called hypnotic. So that would be medications like Xanax. Those are, as people get older, their ability to metabolize those drugs decreases. And so frequently they can end up with too high a dose and too high blood levels. And they may wake up in the middle of the night and they fall. Or even the next morning, they're groggy and it reduces their balance and they fall. In fact, 94% of elderly patients, by definition, that's patients 65 and older, are prescribed a medication that increases their fall risk. So that is something that people need to be aware of. Aromatase inhibitors for breast cancer, those destroy bone. For every 20 women taking an aromatase inhibitor for 5 years, we'll expect one to fracture. Seizure medications, there's categories of anti-seizure medications that create fractures. If somebody's on thyroid medication and it's dosed too high, that can strip the bone of calcium and minerals and create osteoporosis. And that's just the short list. I wrote an article not that long ago, a comprehensive list. It just was published recently on my website, a comprehensive list. I forget the exact name of drugs that destroy bone. And when I did another review of the research, this is after my book was published, and looked at what new data might be out there. That list of drugs that are damaging bone and creating osteoporosis and increasing fractures just keeps growing longer and longer.
Well, the scary thing is, many of those drugs that you just listed were also on a list that we had guests earlier this year, Kleonskis, who were two doctors who work a lot with Alzheimer's disease and all forms of dementia. And many of those same drugs were on the list of things that were increasing those risks of Alzheimer's. And, as well was lack of sleep, from sleep apnea. And so there's really a lot of interconnectedness here that we tend not to talk about. And so I'm wondering, how do we encourage our listeners that are maybe taking some of these different drugs or taking any drug to have the conversation with their physician about some of these other risks? Because when we see the advertisements for these drugs, they blurt them through really fast. They downplay them on the commercials, and everybody's always focused on what's the immediate benefit that I'm getting from this drug, and they don't look at the long-term effects. So how do we get them to have that conversation with their physician, or can they even have it? Because does the physician even understand well enough these drugs and the implications that they have for prescribing these drugs?
Those are great questions. And it's absolutely crucial that people get accurate information. In my chapter in my book on medication-induced osteoporosis, or what the chapter in the book is called Check Your Medicine Cabinet, that I have a take action section at the end. And in that take action section, I counsel people reading the book, write down every medication you're taking and talk to your physician about it. However, physicians are not the experts in medications, in pharmacology. They are the experts in understanding what the indication is and who to prescribe it to in terms of the patient sitting in front of them. But the expert in medication and understanding the more of the risks and having better and quicker access to the databases that can give them that information are the pharmacists. Pharmacists are, I think, the most underutilized healthcare profession, the professionals in our system. They're incredibly well educated, and unfortunately, they spend most of their days just back there filling prescriptions, where their technical knowledge is second to none when it comes to drugs and medications. And you can ask for a consult with your pharmacist, and they will give that to you, and ask them, do any of these medications impact bone health? Does it increase my risk for osteoporosis or fractures or falling? And they can look things up in a database very quickly. That's what I recommend people do. Now, you can do Google searches to give you some indication. That's not always accurate. I also teach people in that chapter how to look up the FDA package insert. So package inserts are required by the FDA for drugs. It lists what the indication is for the medication, how to prescribe it, but also the risks and what risks are there. And there are certain specific sections within that document people can just jump to see if bone or osteoporosis is discussed. Now, if it's not in that document, it could still be impacting bone because that document may not be up to date. But also what we know with medications, about half of the side effects of medications are never discovered until it's on the market anyway. And so that's why you want to look and ask different sources and try and get the best possible information.
Great advice. And diet plays an important role in aging well and is, of course, a foundation of naturopathic and functional medicine. What recommendations do you have for the listener who want to remain healthy and avoid degenerative diseases and age well? I discussed my epigenetics test with True Diagnostic co-founder Hannah Wendt in episode 162. Epigenetic testing measures baseline and changes in your pace of aging, giving you the power to steer your anti-aging or health and wellness journey in the right direction. I learned that I am aging well. Click on the affiliate link in the episode description, use the promo code AGEWELL, and receive a 12% discount on your epigenetics test and monitor your pace of aging.
That's a great question. I looked at the research behind different diets, and there are fad diets and different recommendations out there, high protein, ketogenic diet, water fasting. The list just goes on and on. Gluten-free diet, vegan, vegetarian diet. The research overwhelmingly, when it comes to bone health and osteoporosis, supports the Mediterranean dietary pattern. This is a dietary pattern. It's not just one food, focusing on one food. It's a whole pattern and way of eating. It's been studied for decades. I've never seen one negative study on that. The research is clear that this dietary pattern is associated with reduced risk for not just osteoporosis, a 20% reduction in osteoporosis risk, but a reduction in Alzheimer's and dementia risk, cardiovascular disease, cancer, death from cancer, all-cause mortality, diabetes, obesity. It just goes on and on. It's from the Mediterranean region, as the name implies, and it is essentially a plant-forward diet and the opposite of our standard American diet, which is high in processed and ultra-processed foods and high in red meats and low in fruits and vegetables and whole foods. So the Mediterranean diet is rich in whole grains and legumes and emphasizes lean proteins like chicken and fish a couple of times a week. Red meat is, maybe a couple times a month. And in lower quantities than we typically consume here if you go out to a restaurant, for example, and lots of whole fresh fruits and vegetables. That dietary pattern, as I mentioned, is associated with a 20% reduction in osteoporosis. But more importantly, because that diagnosis is based on a bone density test, and I already mentioned earlier the limitations of that test when it comes to predicting fractures. More importantly, the Mediterranean diet is associated with a 21% reduction in hip fracture risk. And beyond that, what I like to teach people, because I like simple recommendations and simple solutions, it can be challenging for people to transition how they're eating if they're eating more of a standard American diet into this more of a whole foods, plant forward approach. Is that I focus on just two components, plants and protein. That's it. So I recommend, and there's a whole, there's steps of how to transition into eating this way in my book, but 30 grams of total dietary fiber a day, and then calculating how much protein you should get based on your body weight. And this is one thing that's really fascinating to me when it comes to looking at the research on vegan and vegetarian diets and osteoporosis, is that most of those diets, most of those studies showed that vegans and vegetarians have an increased risk for osteoporosis, but not all of them showed that. And it appears that in the ones where it did not increase osteoporosis risk, it's because those people were getting enough protein. The challenge with vegan and vegetarian diets, while we know they're getting enough plants, and plants we know are associated with lower osteoporosis risk and cardiovascular disease risk and diabetes risk and on, while we know they're getting enough whole foods, what oftentimes is lacking in these diets, and what I also see, by the way, lacking in omnivore diets as well, is getting enough protein. The US RDA for protein is insufficient to maintain healthy bone and muscle mass as we age. And in fact, just consuming enough protein within that US RDA limit, or how should I say this? Let me restate this. Consuming an adequate amount of protein is associated with 2 to 4% of your bone density, meaning it can contribute to 2 to 4% of your bone density, just that protein requirement. Because bone is more than just the minerals. A bone density test only looks at the mineral component of bone, but there are over 200 proteins in bone. And so it's a very protein dependent organ. The amount of protein that somebody should get, and what I recommend in the book, is 1.3 grams per kilogram body weight per day minimum. Or if you look at pounds, it's about 0.6 pounds or 0.06 times your weight in pounds. That'll give you the number of grams of protein you should be consuming minimum per day. If you're an athlete and exercising more, then that requirement goes up even further. But most people aren't getting enough protein. So in my book, I also provide this recommendations and the research behind it and how people can calculate their protein requirement and then transition into eating this way over whatever time period is comfortable for you, 4 or 6 weeks, because it often requires shopping differently, preparing foods differently, maybe using different spices. And so I recommend people don't do radical changes overnight because those tend not to be sustainable. This is really a way to transition into how to eat to promote your health for the rest of your life.
We generally recommend on the podcast here, and I do in my classes, about 1 gram per pound of body weight, just because it's an easy number to calculate and it's attainable and it's not excessive. So hopefully that recommendation is being heard. What about dairy? Any thoughts on dairy, especially as we think of vitamin D for osteoporosis?
Yeah. So dairy has some mixed evidence on it when it comes to bone health. It seems to be associated in children when their bones are still growing with better bone health. But we reach our peak bone density and our peak bone mass in our 20s, between about 20 to 29. And after that, there's very limited evidence that it maintains bone as we age. And my concern with dairy is that there are a lot of contaminants that can be in dairy, a lot of different hormones, a lot of chemicals. And you don't need dairy to maintain strong bones. You can get the minerals, calcium and other minerals from non-dairy sources, from sardines, if you like fish, from walnuts, from different vegetables have good, healthy amounts of calcium in it. You don't have to get it from dairy.
An often ignored component of our nutrition for aging well is digestion. Any recommendations for optimizing our digestion and absorption of foods as we eat?
So first of all, reducing chronic stress and getting enough sleep will start to promote and help your digestion. So as you know, there are a couple of reasons commonly that I see why people's digestion is a bit haywire. And it comes down oftentimes to chronic stress, not getting enough sleep, and dysbiosis. That is an unhealthy balance of bacteria, good versus bad bacteria in your microbiome in your gut. Chronic stress and sleep deprivation move that microbiome into an unhealthy state. And so that is a good place to start. Reducing the amount of processed foods you eat can also help. If you need some digestive support with digestive enzymes, that can help. Obviously, if you have perhaps an underlying infection like small intestinal bacterial overgrowth or SIBO, that can get diagnosed through a breath test and a clinician and be treated. The conventional way of treating it is with antibiotics. I prefer a more natural approach using a combination of herbs and diet because it seems to have, it can help kill the unhealthy bacteria without increasing your risk for unhealthy bacteria to grow back. Because one of the problems when we use antibiotics, it just indiscriminately destroys everything, the good and the bad bacteria. Whereas using herbs just is more gentle in that respect. If there's a leaky gut situation, so chronic inflammation in the gut can create leaky gut and decrease the ability to digest and absorb nutrients. There are programs and protocols to help heal the lining of those intestines, to soothe the lining of the intestines and help those cells repair themselves. It's not a one size fits all answer. A lot of it happens to be based on the underlying diagnosis of why somebody's digestion might not be working well. In some people, it could be they don't have enough stomach acid. So conventionally, when somebody has acid reflux, 50% of acid blocking medications are prescribed because of acid reflux. And that can create, substernal burning, burning in your chest. It's positional. When you lay down, you may feel it. And when you sit up, you don't, because the acid is coming back up into your esophagus. If you're laying down and you wake up with a dry, hacking cough, that could be from acid reflux because you're aspirating or breathing in acid particles that are getting into your esophagus, and then you're breathing them down into your lungs. And the reason why for some people, especially as we get older, that they have acid reflux could be because they're not producing enough acid, which is an interesting concept when you think about it. You've got this sense that you've got too much acid, but the reality is you may not have enough. There's a muscle at the bottom of the esophagus. The esophagus is the tube between your mouth and your stomach. There's a muscle called the lower esophageal sphincter that closes. It's a round muscle, and it closes and keeps the contents of the stomach, the acid in the stomach, out of your throat. So it's not going back up. Well, one of the signals for that muscle to close is the pH of the stomach. So when you have enough acid in the stomach and the pH drops low enough, that muscle closes to keep those two areas separate. But when somebody has hypochlorhydria or low stomach acid, or aren't producing any stomach acid at all, that muscle stays open. And so the acid can go back up from the stomach into the throat. And there are many reasons why people can have low stomach acid. It just happens to be, as we get older, there's greater and greater risk as people age. Certain medications can reduce acid. Autoimmune diseases can reduce acid in the stomach as well. And this reflex conventional approach of, well, you've got a symptom of too much acid, so we're going to just suppress your acid with an acid blocking medication, yes, it treats the symptom, but also it creates a dysbiosis. It increases the risk for intestinal infections because one of the roles of stomach acid is to sterilize your food because there are bacteria and other organisms on food as you're eating it. And stomach acid helps to sterilize that. And what happens when you don't have that stomach acid anymore or enough, the food just passes into your intestines and it can seed your intestines with these unhealthy bacteria and create this dysbiosis and create all sorts of problems, including difficulty with digestion, gas and bloating, and also down the road, osteoporosis. And so one of the approaches I like is to test stomach acid and see, are you even making enough? Because if you're not, you can supplement under the care of a doctor, because if you get too much acid as a supplement, it can burn the lining of your stomach. But we can start giving some hydrochloric acid with meals and digestive enzymes to begin to sort of supplement that acid to improve the digestion. And then naturopathically, there are approaches that can be taken where we can naturally start to encourage the stomach to produce more stomach acid and try to restore that to health.
Even with a healthy diet, it's possible to be deficient in key nutrients. What are your recommendations for daily supplements and getting a good bang for our buck?
That's a great question. I think that a lot of people can benefit from a multivitamin and mineral dietary supplement because our soils are so depleted. And even if we try, most people, myself included, don't always eat, the best possible diet. I think that when it comes to looking at quality of dietary supplements, there are three things that I teach people that are important, because it is buyer beware out there. You've got to understand what to look for on a label to make sure you're getting your money's worth. So I have people just look at a couple different things. So first of all, look at the minerals on a multivitamin and mineral supplement. You want to look for the most absorbable minerals. So if it says oxide or sulfate with the minerals. So minerals are never just by themselves. Magnesium has to be attached to a molecule that carries it into your stomach and into your intestines. And then your body has to break that apart, has to break the carrier molecule, separate the carrier molecule from the mineral in order for you to be able to absorb the mineral. So if it's in the oxide form or with calcium, the carbonate form, or with other minerals in the sulfate form, those are the least absorbable forms of the minerals. So for example, magnesium oxide, your body can only absorb about 2 to 3% of that. So if it says 100 milligrams of magnesium as magnesium oxide, you're only absorbing about 2 to 3 milligrams of that, meaning it's passing through your intestines and getting into your bloodstream. The rest is staying in your intestines and you're just pooping it out. And in fact, in high dosages, hundreds of milligrams of magnesium as magnesium oxide or magnesium sulfate, we use that as a laxative. If you look at Epsom salts, which is magnesium sulfate, there are instructions on there how to use it as a laxative. When you get too many minerals not being absorbed and they stay in the intestines, it draws water into the intestines and it causes a diarrhea. It's an osmotic laxative. So you want to look for more absorbable forms of the minerals. Look for citrate or malate or amino acid chelate. Those forms are much more absorbable, so you'll be getting more of your money's worth. The other thing to look at is the vitamin B12 and the folic acid. Many people have a hard time methylating. There's a genetic polymorphism, which is called a methylation defect. It's common where people aren't able to methylate their B vitamins, and the methylated forms of the B vitamins are the bioactive forms. Now, you can get tested genetically to see if you have that, or simply just look for a product that has the methylated forms of those B vitamins. Then you're taking what you need. They are the superior forms anyway. So you want to look for methylcobalamin. That's the methylated B12. Oftentimes you'll see B12 as cyanocobalamin. You can't use that. Your body has to process that, transform it into methylcobalamin in order to be used, and many people can't do that. Same with folic acid. You want the methylfolate form instead of just straight folic acid. The methylfolate form is the activated form of that B vitamin. And then the other thing you want to look at, and I would say the last thing to look at is, look, if it's a 1 a day pill, it likely doesn't have the type of nutrients, meaning that the form of the nutrients that are most absorbable. And by the way, why do manufacturers use the oxide form and the sulfate form of minerals? Because they're cheap, and you can patent their, and you know, minerals and these nutrients, they take up space, right? It's not even microscopic. It's, biochemically they do take up some space, and when you've got the magnesium citrate, it's a bigger molecule than the magnesium oxide. So they could say 100 milligrams of magnesium as magnesium oxide and get that into one pill along with the other nutrients. But you couldn't do the same if all the minerals were in the amino acid chelate or the more absorbable forms, the citrate forms, because they take up more space. So you want to look for things that are probably at least 2 or 3 or 4 capsules a day.
That's good advice. And I've been interested in trying to manage my cortisol levels and stress levels lately. I try and maintain regular sleep cycle, have a bedtime, try and get up in a normal time. Although I'm still not always getting the most restful sleep. I started recently kind of monitoring the sleep, using a health tracker. And like I woke up this morning and really didn't get good quality sleep last night at all. And a couple of things that I've started doing, and I don't know if they're beneficial or not, but I drink salt and lime water in the morning, and I take 100 milligrams of omega-3 before bed. Any thoughts on that water concoction and the timing of omega-3? And is there anything else that I could be doing to kind of better coordinate my cortisol levels and cycles in order to age well?
I don't know of any, the lime water in the morning, the omega-3s in the evening, even that dose, 100 milligrams, which is quite a low dose. I don't know of any
1,000,
research or even mechanistically, say 1,000. But I've never seen any research where omega-3s help with sleep at any dose. Maybe it exists and I've missed it. But that's not the first thing I think about. And that's not the first thing I think about when it comes to regulating cortisol. So when, first of all, cortisol spikes in the morning between about 8 to 10 a.m. And if you're waking up groggy and then you have a hard time falling asleep at night and feel a little wired, your cortisol daily pattern of cortisol secretion may be flipped. Maybe your cortisol may be higher at night and lower in the morning. And there's tests. You can do a cortisol test. I like the salivary cortisol times 4. You do it at 4 different time points during the day to track that over time, over the course of the day. But to regulate cortisol in general, first of all, practicing some stress reduction techniques can be very helpful, whether that's yoga, meditation, exercise, psychological counseling, things that help you deal better with stresses in your life. That's important to consider. Going to bed at a consistent bedtime can help with sleep quality. So there are 2 main conceptual things to understand about sleep. There's sleep quantity and sleep quality. You can get fewer hours of sleep, but still feel rested because your quality of sleep is very good. And you've gotten into that deep, stage 3 and 4 sleep that are the restorative stages of sleep that we need to feel rested and restored. Fitbit did a fascinating study years ago. They had billions of data points because so many people use their products, and they looked at what is the best indicator of sleep, of healthy sleep. They looked at, is it the male versus female? Is it the age? Is it where they live? No, it was none of that. The most consistent indicator of somebody's healthy sleep is a consistent bedtime. That means training your body and going to bed about the same time every night. What they found is what happens is, during the week, people have obligations. You've got to work in the morning or you've got to go to school. And so people are on a pretty regimented schedule. But then Friday night comes along, Saturday night comes along, and people are going out and they're staying up later. By the time Sunday night rolls around, their body believes they've flown to another time zone. It's as if they've gone to a different time zone. And this is a phenomenon that Fitbit termed social jet lag. And so then Sunday night rolls around and people have a harder time falling asleep, and they start the week with a sleep deficit. And so just going to bed at a consistent hour, and you can practice there breathing exercises you can do to help you fall asleep. There's white noise you can put on, making sure the temperature of the room is the best optimal temperature for you, which could be 67 to 69 degrees, somewhere around there tends to be the sweet spot for a lot of people. That there are no other noises that could bother you, that it's dark in there. These are practices called sleep hygiene that can be very effective. Not eating several hours before you go to bed, not drinking several hours before you go to bed. That can all be helpful as well. And then if you need some extra support, there are supplements out there. Most people, when they think of sleep, think of melatonin. Now, I'm not a fan of just using melatonin because melatonin has a very short half-life. It only lasts about an hour and a half, meaning that you take melatonin and about an hour and a half later, it's gone out of your system. What most people then end up doing is take higher and higher doses of melatonin to completely knock themselves out. And then they feel groggy and drunk and hungover in the morning. In the body, the role of melatonin is not to maintain sleep. It's to help get the body prepared for sleep. And I had horrible insomnia for years. I tried all sorts of different products. I finally, in a survey I put out to my massive newsletter list, the most common complaint that people were having that they wanted me to help them with was sleep. And I was shocked because there's so many sleep products out there. So I dove into the research. It took me about 8 months of looking at the neurobiology of sleep, the biochemistry of sleep, what else is the clinical trials that have been done. And what I created is a product called Sleep Relief that is a biphasic time release system and tablet. So people typically have a problem either falling asleep or staying asleep. It can be both, but falling asleep or staying asleep. So phase one releases its nutrients in the first about 30 minutes to help people fall asleep. And phase two over the next 4 hours to help people stay asleep and maintain that sleep. Or if they wake up, they can more easily go back to sleep. So then they feel refreshed and awake and alert in the morning and not hungover and groggy. One of the reasons why people can wake up in the middle of the night is if their blood sugar drops. Your blood sugar drops, and then cortisol and epinephrine increase. That releases blood sugar that's stored as glycogen in the body, but it also wakes you up. Things that impact that blood sugar regulation as you sleep is alcohol. So avoiding alcohol, especially before you sleep, is important. But also within that formula that I created are herbs and nutrients to help balance cortisol, to help support healthy blood sugar, but also to target those different neurochemical pathways involved in sleep initiation and sleep maintenance.
Yeah, I think for me, my biggest issue is, I fall to sleep just fine. I get up okay. I, usually bed by 9:30, up in the morning about 4:30, unless I just really don't get good sleep. But for me, it's getting up, and it's, waking up. And when I do wake up, it's having to go to the bathroom, and, it's not really having to go to the bathroom, but having that urge to go to the bathroom. And, so I've been trying to kind of manage.
Are you talking about at night?
In the middle of the night? Yeah.
Yeah. So that can be also in men, it can be an enlarged prostate. So making sure that gets evaluated, and they're good, both medications and natural products that have been shown to help with that. Again, stop drinking a little earlier in the night. That can be, maybe helpful. If somebody has acid reflux, that can keep waking them up at night. So if that could be an issue with people as well. But in terms of getting enough quantity of sleep, you go to bed early, you get up, you're getting looks like a full 7 to 8 hours of sleep, but you're still not waking refreshed. What's going on? The question I would ask, that you're not either maintaining that sleep or you're not getting into that deeper levels of sleep.
Yeah. And for me, when I wake up, I can look at the clock and it's almost the same every night. So it's really kind of interesting.
Well, I'd be happy to send you a bottle of my sleep relief to try. You can give it a shot.
I'm going to try that. Yeah, just trying to get everything kind of in order, because I know that impacts so much. If I'm not getting enough sleep, I know I'm having trouble with kind of maintaining healthy body composition and all those types of things. And I don't get up, I don't work out because, that's my best time. Another thing I think that's keeping me up is just shoulder inflammation. It's probably one of the biggest things for me, I think, lately. I've had chronic shoulder issues for a long time.
Well, and you raise a great point. I mean, chronic pain and muscle tightness and chronic pain is another reason why people have a hard time sleeping. I did put in my product, some magnesium, because that's a gentle muscle relaxant. So people, taking some magnesium before bedtime may be helpful for chronic joint issues, tendonitis, tendinosis, rotator cuff injuries. Regenerative injections are phenomenal at helping to regrow that connective tissue to stabilize the joints. If that's the underlying cause of the pain and discomfort, that could be a phenomenal modality to look into.
Yeah, I've been considering kind of looking into that, because I'm pretty sure right now it's more of a little bit of a labrum tear that just is rather chronic.
I had a labral tear, and it was repaired by those injections. So I went to a colleague of mine here in San Diego locally who does it. In my clinic in Montana, I used to do, it was probably half of my practice was regenerative injections. And he did a whole series getting under ultrasound where the labral tear was and hitting. It's like spot welding. You go and put the needle where the tear is, tap the bone a little bit, because that helps release more growth factors and nutrients into the area, and then inject the solution. Different doctors will put different stuff in the syringe, but that then stimulates those cells to grow more connective tissue. This was several years ago. I did not have to have surgery, and I'm back to 100%.
Right. And what type of doctor do you need to see to kind of get that kind of procedure rolling? I guess it maybe depends on your insurance a bit.
So, yeah, that's a great question. I don't know about the insurance reimbursement aspect of that. You are in Oregon, is that right?
Yes. Mm-hmm.
Yeah. So in Oregon, there are phenomenal doctors who are trained in this. So you can just look for prolotherapy or regenerative injection and search for that. And, naturopathic doctors, I know some up there who do a great job with that. There are medical doctors, I'm sure, who do it. One of the challenges is, similar to osteoporosis, there's no board certification for it. And it really comes down to clinician training and clinician competence. And if a doctor I've heard stories from patients, they come to me because they didn't get help. The doctor said, "Oh, I do regenerative injections," and they put the needle in one spot and injected the solution, and that was it. Well, that actually isn't the optimal technique. The optimal technique is to pepper the area. You're doing multiple injections in the area to get a better coverage. And so evaluating the quality of their training is important. I like to tell people, don't go to somebody unless it's at least half of their practice and they've been doing it for at least 5 years.
That's great advice. And I hope the listener is kind of listening to that, because I do think a lot of people just go to their physician. A physician says, yeah, do this, and one injection, and they think they're going to be okay, and it doesn't do them any benefit. So that's great advice. Let's see, we've talked a lot about sleep, so we can kind of move on from that. But we've discussed on previous episodes some of the research on creatine supplementation for aging well, specifically implications for brain health and possibly depression. The literature suggests that about 2/3 of the American population is deficient in creatine. What are your thoughts on creatine supplementation for the general population? And what are some ways that functional medicine can benefit mood, brain health, and even reverse depression?
In terms of creatine, I've not looked at the research or the clinical trials, so I don't have anything of any substance to say. If I started to spout off about it, I would just be speaking from a place of ignorance, and I would not want to do that to your listeners. I don't know about that nutrient in the clinical trials. In terms of what can be done for brain health and mood, however, there are many things that people can do. starting at the foundation, like we've talked about already: sleep, diet, exercise. Non-negotiable. Those are non-negotiable. Looking beyond that, if you're looking at supplementation, there's great evidence on omega-3 fatty acids. So looking at EPA and DHA, at least 1,500 milligrams combined of the two of those. Looking at huperzine A is a nutrient from Huperzia serrata. It's an extract. It actually works on the same molecular pathways as the FDA-approved medications for mild cognitive impairment, like donepezil. It is not a medication. It's not approved by the FDA to diagnose, treat, or prevent any cure any disease. But there are clinical trials showing that huperzine A it improves or increases acetylcholine, which is involved in memory. And there are clinical trials both in students studying for exams and in adults, and showing that it promotes and supports healthy memory and recall in the dose of I guess 200 micrograms per day, maybe 400 micrograms. I forget the exact dose. I put it in my Brain Blend product in the clinical trial dose. I just can't remember exactly. This was years ago what I formulated it with, but that's the dose that was used in clinical trials. Acetyl L-carnitine, a form of L-carnitine that crosses the blood-brain barrier, that has good research on it as well. There are other ones like citicoline, or just using choline, that has good research on it as well. There is Bacopa that has some good research on it. There's quite a long list, but diet, lifestyle, sleep, that's the foundation.
Great. Now, for the question I ask of all our guests, what are you doing personally to age well?
Great question. I'm trying to do everything that I talk about. I typically am in bed and lights out between 10 and 10:30. I am in the morning. I wake up. I drink a large glass, 24 ounces of good clean water first thing before I have my coffee. Then I eat some oatmeal, unsweetened. I don't add sugar, with walnuts and blueberries in it. Typically can be my breakfast. I'm consuming about 90 grams of protein per day in my diet. If I feel like I'm falling short that day in my diet, then I'll supplement with a protein powder. I'm a believer that dietary supplements should be used as the FDA intended, that is, as a supplement to a healthy diet. I'm eating primarily a plant-forward diet, like I talked about, that Mediterranean-style diet. I'm taking time every day for myself for stress reduction. I'm exercising 5 and 6 days a week. And it doesn't always, by the way, have to be in a gym. The research shows that even if you just walk 7,000 to 7,500 steps per day on average, that's associated with a 50 to 70% reduction in all-cause mortality. So I like to switch things up, not do the same thing every day. I am connecting. I'm connecting with my wife. I'm connecting with friends. I'm involved in my community. I'm doing those sorts of things that I discussed. I am taking supplements that I know have been shown to be important for supporting my health. So I take Best Catch Omegas, my omega-3 supplement. That has the 1,500 milligrams minimum of EPA, DHA. I take that every day. I take natopine. It's a nattokinase product that has the highest dose nattokinase combined with pine bark extract, also that I created for my patients to help promote healthy circulation, to support delivery of nutrients to tissues throughout my body. I take my multivitamin, Supreme multivitamin, every day. I take my vitamin C. I take some extra vitamin D. I take my MK4 product to support healthy bones and healthy health throughout the body as that form of vitamin K. So that's about, that's what I do. And I take my sleep relief at night to help me sleep, and you get the temperature down, and for me about 69 degrees in the bedroom, and close the shades. And that's what I do.
Great. Well, this has been a fascinating conversation. I think I could go on asking you questions. but I know you have a life outside of my podcast, so we'll keep it short. And for the sake of time, is there anything else that you would like to add? How can our listeners connect with you? Do you have a web page or social media? Fracture Proof Your Bones is your most recent book. Are there others you want to recommend to our listeners?
A lot of the stuff in the other ones that I wrote years ago, like A Revolution in Health, we'll talk about approaches to testing. I had some proprietary testing panels through a lab at that time. So those tests are available over the counter. But if you read that book and want to know what those tests are, because I use the proprietary names, just let me know. But that discusses the functional medicine approach. And the Fracture Proof Your Bones, my most recent book, is more of a how-to guide. And if people follow those recommendations, even if they don't have osteoporosis, even if they aren't at that age where it's a major concern for them, all of those recommendations in there in terms of diet, lifestyle, also will reduce the risk for other chronic diseases like diabetes and heart disease and dementia. It's the similar recommendations for all of those. So if you just follow the recommendations in that book to set that foundation for long-term health, not only can you experience better, memory and mood and energy and vitality, but you're also supporting your bone health and reducing your risk for other chronic degenerative diseases. People can find out more about me on my website, nbihealth.com. There are lots of free articles on there. My products that I mentioned, my book is also available at nbihealth.com, and you can connect with me through the website as well.
Great. Again, a fascinating conversation, and we thank you for sharing your time with us on the Aging Well podcast. I appreciate all the work that you're doing and encourage you to keep aging well.
Thank you.
Thank you for listening. I hope you benefited from today's podcast, and until next time, keep aging well.